Hey, I'm Dr. Tessa Commers. I'm a pediatrician, and I have a special interest in sexual health. I'm the head of medical education at Julie. Today we're defining what is safe sex. So what does a doctor hear when someone uses the term safe sex? Well, I generally think of two different things. One, that someone is taking precautions to protect themselves against sexually transmitted infections, and two, that someone is taking steps to prevent themselves from getting pregnant if pregnancy is unwanted. The reason that we separate the two is because the way a couple protects themselves against STIs is different than the way a couple protects themselves against pregnancy. So protection against STIs involves a few different things. First, testing. Regular testing is the best way to figure out if someone has an STI, and then if testing positive, they undergo treatment. Treatment of an STI prevents spreading to a partner. The second aspect of this is barrier protection, and that's specifically in the form of condoms and dental dams. So condoms, when placed on the penis, can prevent a number of STIs from passing when engaging in penis to vagina sex and penis to oral sex. Dental dams are a form of barrier protection that protect an individual's mouth from catching an STI when performing oral sex on a vagina. The last way that someone can protect themselves against STIs is in the form of vaccines. There are a few vaccines, including hepatitis B and HPV, that reduce someone's risk of catching an STI. Julie is a type of emergency contraception that protects when someone engages in unprotected sex. And so unprotected sex implies that maybe a condom wasn't used or the condom broke. And in that case, STIs are something else to consider in addition to a pregnancy risk with unprotected sex. STI testing is incredibly easy. All someone has to do is either make an appointment with their primary care provider or go to a local clinic. And if you have female genitalia, it might involve just something as simple as a swab in the vagina. And if you have a penis, it can be as easy as peeing into a cup. There are a variety of ways that someone can protect themselves against pregnancy. They include barrier protection like condoms, hormonal methods like birth control pills, the IUD, or the implant, or ovulation tracking. Many individuals consider the pull-out method to be their main form of birth control. And while it can be effective for a variety of couples, there are a few things to consider. First of all is that pre-cum or pre-ejaculate, which is a little amount of ejaculate that comes out 30 seconds or so before actual ejaculation, can actually contain sperm, especially if you have masturbated or ejaculated recently. The second thing to consider is that sometimes ejaculation happens, and that is human error. Julie, the emergency contraception pill, is a safe form of pregnancy protection if you and your partner engage in unprotected sex. When a couple engages in unprotected sex, there are two things to consider: pregnancy risk and STI risk. So first of all, pregnancy risk. If a couple's wishing to avoid unwanted pregnancy or mistimed pregnancy, then emergency contraception is going to be the best option. This is in the form of the morning after pill or IUDs, which can be placed by a trained medical professional. The other thing to consider is STI risk. If you are concerned that you may have passed along an STI or received an STI, the best thing to do is to undergo testing about 2 weeks after unprotected sex. I hope you enjoyed this video. If you want to see more like it, you can hit the subscribe button. And if you have a question, leave it in the comment section below. Thanks for watching.